Hi, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And I bid good morning to all of you. Okay, so today all four of us are going to present to you about ELISA, which is one of immunoassay technique in immunology for our subject MIC 343. So let's know our group members. Our group members are Nur Fatiha binti Muhammad Hatta, Munira Suhada binti Mahzir, Nurul Suhada Azwa binti Muhammad Zain, and Sharifah Nurin Amira binti Saif Osman. Without further ado, let's start now. Okay, principles of ELISA. What is ELISA? ELISA is actually an enzyme-linked immunosorbent assay, which are a plate-based technique that are conducted to detect and also to quantify soluble substances such as proteins and antibodies. So, the principle is the target protein or the antigen will be immobilized on a solid plate. They are called as microplate and then will be complexed with antibody-linked enzyme. The microplate that are usually used in the laboratory are 96 well or 384 well polystyrene plates. Okay, next, the detection will be observed by measuring the activity of enzyme with substrate during the incubation period. The color changes also will be observed. Okay, what is the enzyme used? The enzyme are called as reporter enzyme. The signal that produced by the reaction of enzyme with appropriate substrate will be used as detection. But the signal must be associated with the presence of antibody or antigen. Hence, no antigen, no signal that will be produced. Okay, ELISA format has four. First, direct, indirect, sandwich, and competitive. Next, let's look at the labels in immunoassay.
Thank you, Mira. Then we are moving to labels in immunoassay. What does it mean by labels in immunoassay? Labels in assay is used to aid in detection or isolation or even purification of a protein such as antigen and antibody. Then, the labels that are usually used in ELISA immunoassay is enzyme reporter such as horseradish peroxidase, HRP, alkaline phosphate, AP, glucose oxidase, and B-galactosidase. Enzyme reporter is also larger than biotin, however, rarely disrupt antibody function. It can produce colors such as brown, purple, and yellow when react with substrate. The second labels that are usually used is biotin. Biotin often employed to increase sensitivity of assay when an antigen is difficult to be detected. Next is classification of ELISA.
Hello, so now we are moving forward to see the classifications of ELISA. Okay, so there are four types of ELISA, which are direct ELISA, indirect ELISA, sandwich ELISA, and competitive ELISA. For direct ELISA, we will be using enzyme labeled primary antibody only. The enzyme labeled primary antibody binds to the target and is immobilized to the plate. Then the enzyme linked to primary antibody reacts with its substrate to produce signal and can be measured. For indirect ELISA will be using primary antibody and secondary antibody. Primary antibody will bind to the antigen immobilized to the plate, then enzyme labeled secondary antibody binds to the primary antibody. Then the enzyme linked to secondary antibody will react with its substrate and produce visible signal which can be measured. For sandwich ELISA, we will be using the detection of antibody. Antibody are immobilized on the microplate well, then the primary detection antibody binds to the antigen. And lastly, the secondary detection antibody binds to primary detection antibody, which reacts with substrate and produce a visible signal and can be measured too. And lastly, we have competitive ELISA. Competitive ELISA will be using inhibitor antigen. Antibody are immobilized on the microplate well. After that, it will be incubated with target antigen and a labeled reference to complete for binding at the limited amount of antibody immobilized on the plate. And which will be resulting the higher antigen concentration, lesser antibody will bind. Therefore, less signal. So the question is, why are we using ELISA compared to other tests? Which is, if we see Western blot, we use also the antibody and antigen antibody and detection antibody. But based on what I heard and what I learned from Dr. Muaz, he said the major difference between ELISA and Western blot, ELISA are much more accurate than the other tests. Therefore, in many hospital or in any medical researcher, they are much more using ELISA is as it will just give as much more accurate result than other tests. So, next we will proceed to Nurul Suhada Azwa.
Alright, now we will move to the use of ELISA test. ELISA test can be diagnosed to test several diseases, which is one is HIV. HIV is caused by AIDS. Next, Lyme disease. It is an infectious disease caused by Borrelia bacterium, which is pricked by a tick. Next, pernicious anemia. This is the condition caused by a little vitamin B12 in the body. We also have Rocky Mountain spot fever. This is the disease that is caused by bacteria infection spread by a bit from an infected tick. Rotavirus also is a very contagious virus that is caused by diarrhea. And lastly, squamous cell carcinoma. This is the second most common form of skin cancer. Thank you.
That's all from us. So here are the list of reference that are used by us in our presentation. We hope you have more understanding towards ELISA. Thank you.